So, how are you today, sir?
I'm good.
All right. So, first things first, I'm gonna get you to put your glasses on because
Okay.
I want to protect your eyes, and then I'm gonna wash my hands and everything, and then we're gonna kind of go over what's going on. So I'm gonna just put this like purple solution on your teeth to kind of see how good you're brushing, and then we'll go from there.
Okay.
It's not gonna taste bad at all. I'm just gonna rinse it out, and then we'll kind of see where you're from there.
Sounds good.
Let me wash my hands.
This is why we shouldn't have been together.
All right, let me get my gloves on. Get you all disclosed there. And tell me a little bit about yourself, sir. How are you feeling today?
Feeling great.
You feeling great?
Yeah.
I had some notes in there that said that you kind of feel sad sometimes.
Yeah.
Is that very often, or?
I'm clinically depressed all the time.
Oh, okay. Now, does that cause any pain in your mouth or anything like that?
No, just lack of motivation of brushing.
Okay, all right. Well, we're going to kind of get you a method today that kind of helps with that.
Okay.
And we'll kind of get you on a schedule. And once we get you on a schedule, maybe that will help you out a little bit better.
Sounds good.
And are you good on brushing every day, or do you have any problems like brushing twice a day?
Sometimes I just forget to brush for a few days in a row.
Oh.
Do you need a mirror?
And my patient, you already did your mouth rinse and everything like that?
Yes.
And we're just gonna go ahead and have that. Just
I'm grading you on this part? The satisfactory? Like,
You're doing
you
everything.
student self-assessment. I check these.
Okay. I can't take these. All right. So we already did your mouth rinse, and then now I'm gonna disclose.
Yes.
All right. We're gonna kind of see how much brushing you do a day. You might have some purple lips, so that will go away. I promise. It doesn't stay there for long. Alright, I'm gonna rinse it out here, and then we're gonna kind of clean you up and go over some stuff. There you go. You're give you a good rinse out. Okay. I'm gonna lean you up. Alright, I'm gonna kind of move that out of the way. Alright, so I'm gonna give you this mirror. Alright, I want you to look in the mirror and look at all that purple and pink solution. You see all that?
I do.
So, in those areas, it's called biofilm, and it's kind of just little bacteria that are growing in your mouth. So, we're going to give you a toothbrushing method that kind of fits that, so we can get that out of the way, and we can get into killing the bacteria. They leave acid, and they can lead to caries and periodontal disease and gingivitis as well.
Okay.
Do you have any questions?
Nope, I think I'm good.
Okay. All right. So, since we went over that, also too, with depression, it can lead to periodontal disease and caries if you're not brushing really good. So we're going to give you some methods to kind of prevent that. And don't worry, sit and look at your medical history and your periodontal chart. And it did say you had a couple bleedings around some areas that shows gingivitis. Don't worry about that. We can reverse that. It's very reversible, and we can leave you to have gingivitis, so you're good.
Sounds good.
Is there any changes in your medical history or anything like that?
Nope. That's what's there.
Okay. You have some motions and stuff like that. Is it hard to floss around that permanent retainer since you do have depression?
It's not difficult to get the floss in, but I just forget to.
Okay, that's very common in patients. It will make it easier to floss since you do have it on this teeth. So we'll kind of just show you a way to put it in there, get it done,
Okay.
and maybe give you an easier way to just kind of motivate you in the right direction.
Okay.
With that being said, do you have any questions?
No, I think I'm good.
Okay, alright, we went over and everything like that. We went over medical history. Let's look at your tabs here. Alright, so do you have any coughing or anything like that? Any changes to your EMJ or
No.
anything?
Everything's good.
And we already did your bio, so I didn't feel anything abnormal, so everything looks good. Do you have any questions about that?
No.
Have any of your habits changed or anything like that? Are you a no-biter or anything?
Nope, not anymore.
Smoker?
Nope.
Do you like sugars?
Oh, all the
candies,
time.
Soda?
Oh, yeah.
Okay, alright, so that does lead to like caries and stuff, so we're gonna kind of get you motivated into brushing a little bit so we don't cause that damage to your teeth. Because once you damage your enamel, it's very hard to minimize it. Okay, and you said there's no pain, correct?
No pain.
Okay, is there any hot, cold, sensitive, biting or anything?
Cold sensitive. Yeah.
Do you use an MI paste or anything like that?
I don't even know what that is.
Okay, alright, so it's kind of like a toothpaste that helps you remineralize your teeth, and it does help with hot sensitive and cold sensitive teeth. And I'm guessing you had ortho treatment in the past?
I did.
Okay, so did they ever give you retainers?
No, they just gave me the lingual bar and that's it.
Okay, I will let you know if you do go through them, it might be a little bit cheaper. You can go in with us to get a retainer. You can put that in my face in the retainer.
Oh.
You'll put a pea size in it, you'll sleep in it at night, brush the retainer really good, and brush your teeth in the morning, and that will actually help with just keeping that hot, cold sensitivity to your teeth. Okay? And also, I do have a pamphlet in my... Alright, I do have a visual aid for you, and it just goes over what depression can lead to and what it can cause. Little there, and you can just see how it can lead to poor nutrition and just drug induced and stuff like that, and what it can lead to, and then just gives you some effects there. All right, then let's see. We have a couple more things to do. We went over it, and after reading this, do you have any problems with that?
Nope, everything looks good.
All right, well, let's go on to the next page then. I'll hold that for you so you don't have to worry about that right now. All right. So we need to kind of figure out what's going on with your methods. So we need to kind of give you a good schedule and what kind of toothbrushing method works for you. So today I'm going to kind of get some information from you, and then we can kind of figure out if we need to change anything or see if there is something we need to encourage you to do. So what kind of toothbrushes are you using?
I just have a manual.
Just a regular manual one?
Yeah.
So with depression, sometimes we say to use an electric toothbrush because maybe you're sad and you don't really want to brush your teeth. So the electric toothbrush is doing all the motions for you. But it's going to be the same method with a manual toothbrush. We'll kind of show you how to do that today, and I'll get you to do it so we can make sure you're doing it the correct way.
Sounds good.
What kind of floss do you use?
I don't really use floss.
You don't use floss? Okay, well we're going to just say we rather use floss before you brush your teeth so we can get that fluoride in that toothpaste to get under that gum to kind of help prevent gingivitis. So that can help reverse it so we can get you on the right track. So we're going to show you that today as well. Do you have any questions so far?
No, this time.
Okay, all right. Let's see. And like I said, in my case, you can use that if you want to for the hot and sensitive. But today we're just going to do a fluoride mouth rinse just to help you. So if you're not feeling really well and you're feeling really down, if you don't want to really brush your teeth or anything like that, use that fluoride mouth rinse to kind of break down those bacteria and then brush your teeth when you are feeling better. Okay? I'm going to just do some, I'm going to write some notes over here for a second. And then we already looked in the mouth. Did you smile for me? Alright. I've already looked in there. I'm going to note everything where the purple is, okay? I'm going to put that on this paper. I don't have that many spots, which is really good. So that means you're doing well. But I did see that you're having some issues in the back. There's a smaller toothbrush, a turf toothbrush that we're going to kind of use as well, and that will kind of help get those back in those molar areas. It'll help prevent that purple from getting there. All right. Get you put your glasses back on. All right, we already talked about what toothbrush you're using, and then I'm gonna get you to demonstrate how you brush with your teeth.
Oops. Awesome. So usually I just kind of.
Okay. Well, let's get you a new toothbrushing method, okay? And can you show me how you're flossing,
Yeah.
sir? Let's just use this one.
So, like I said, I don't really floss, but if I.
All right, well, we're going to do some toothbrushing method and a new flossing method. We don't want you to destroy your gums, which is very easily done.
Yeah, I bleed every time I floss, so I just don't do it anymore.
Oh, okay. Well, maybe we should lighten up the pressure a little bit. That may help a little bit. And it looks like you're going too much into the gums, so you're puncturing the gums every time you're going down. So let's ease it a little bit, okay? All right, so now I'm going to say that the best toothbrushing method for you would probably be the modified Stillman
Okay.
or the modified Bass. But today we're going to do the modified Stillman first. Okay? We're just going to start off very easy, very simple. Then we'll go into the more extinct one. Okay? So I do have a pamphlet here I'm going to give you. So maybe this will help as well. It's got some images. So it also has biofilm. So I have a pamphlet here for him as well. This is a different one. And it's from the ADA. Sorry. It goes over how biofilm is formed, what biofilm can do, and how it causes demineralization, and how that remineralization, sorry, there's some hard words to do. So that MI paste will help with the remineralization, and then the okay, they already got hard.
That's good.
Okay. Then, biofilm can cause caries, which is right here. It shows in here. So these are kind of, this is an x-ray, and then this is just a regular picture. Okay.
Those look like my teeth.
These? Okay, so you have those spots up there on your teeth?
I feel like I see them.
Okay. Sometimes food can get caught into those little crevices of your teeth. And so sometimes just brushing your teeth can cause those to go away. So I didn't see any cavities on your x-ray today, so I think you're doing good. Maybe there's just some food particles stuck in there. All right. So right in here, see that stain right there?
Yeah.
That's that purple stuff that's on your teeth right now. So then right here is just kind of, this is what it looks like now before you did the purple stuff. And that's showing all the biofilm.
Right.
Okay. I'm going there. Alright, that's bone loss. So if you don't brush really good and you don't floss really good, that can cause periodontal disease.
Okay.
And that causes your teeth to be very mobile. And your teeth don't have as much bone. And once you lose that bone, it does not come back.
Okay.
You actually have to have a surgery and have a whole bunch of stuff done. But we were trying to prevent that. But your teeth look good. I didn't see any of the bone loss or anything. So you're doing really good. But we just want to stabilize it and get you better and healthier. I'll cover these gloves in a minute. Alright. So this is what we're going to go over now. We're going to go over the brushing.
Okay.
So we're going to do brushing twice a day with a fluoride toothpaste to remove that biofilm from the teeth surface.
Okay.
Then we're going to do flossing daily, just once between all the teeth. Did you ever use any other dental instruments or anything? Did you use like a tongue cleaner or anything?
No.
Okay, so you didn't use floss, so no interdental care or anything like that? Okay, so you did the floss, you did the toothpaste, everything like that. Alright, so and I'm going to show you some flossing methods, okay? So I'm going to kind of get you to hold this too. Not this toothbrush, but the mouth here. I'm going to get you to just hold that for me, okay? So, with this one, you're just going to, with your ring finger, you're just going to wrap it around a couple times, okay?
Okay.
Then same thing, your ring finger. You're going to wrap all the rest of it in your ring finger. Really loose, not really tight, okay? You're going to take them and kind of, it doesn't take a lot. But every time you floss, you want to get a new piece of floss. Because if you go in with the same floss, that biofilm is going right back in that same area. So you don't want to do that. You want to go in a C-shape floss.
Okay.
It does look a little bit different than in your mouth, okay? So I'm going to get you to do it on the model in a little bit, okay? So you're just going to push it down really gently, kind of seesaw it back. You're going to do a C shape here, pull it down, go up a little bit so you're not going to be interproximal. Get to that other side, and you're just going to kind of go up, 1, 2, 3, same thing, and then just seesaw out. Then you're going to turn it and release. So just turn, release, okay? And you do that same thing, so go 1, 2, 3, 1, 2, 3, and then you just go really gently, and then you go turn, release, okay? I'm going to do it on the other side as well, okay? So you're just going to seesaw it down there. Sometimes it's a little harder, takes a little bit, a couple more times. You're going to do 1, 2, 3, pick it up, and then do a seesaw, 1, 2, 3, pick it up. Sometimes you can use your tooth, and you're going to kind of put your fingers, your front fingers, to kind of pull up and it kind of helps release that floss. Okay? Alright, so Is there any other questions or anything like that?
No.
Okay, now I'm going to show you the floss better. And that's going to kind of help get in there where your permanent retainer is. So we don't have a permanent retainer on this model, but we can pretend, right? We definitely can. Sometimes we have to do the double floss. But right now, we're going to get you to use the waxed floss. It's a very common floss. That kind of helps get into those interproximal areas in between the teeth really easy. And it's very simple, okay? So, you're going to go, you see how it goes to a V shape?
Yeah.
You're going to go right in between there. Alright, yep. And then you want to go floss underneath that bar. So you want to go 1, 2, 3, 1, 2, 3. But it's not all the way. It's glued on 2 teeth. So your canine, your pointing vampire tooth, your vampire tooth over here. So you'll basically just pick it up in the back on the front side and you'll wiggle it to the next. So you don't have to use that floss there. So that won't cause any more leaking from there. So the pressure right there is really light. You want to make sure you're getting really close to that tooth. And then you'll pull it up. And then you'll just pull it out like that. Okay? Any questions from there? Okay, I'm going to take this from you. And then we are going to do that fluoride mouth like you did today, like I demonstrated in the beginning, before we started. And that kind of gets rid of that biofilm in the mouth before I start working on you. Okay? So that kind of helps out there. Do you have any questions before we go on?
No.
Alright, so I think we already went over when and all that. So I'm going to take that paper from you, and we're just going to go over it again. There is a paper in here that kind of goes and shows you when you do that. So let's just go back. So you'll get to take this paper home.
Okay.
And whenever you ever need this, you can refer to this, or if you have any questions, you can always call us.
Okay.
So like I said, you're going to brush twice a day, floss once a day, and then rinse once a day.
Okay.
I would try to do mouth rinse in the morning and at night. And that's just your preference. But for right now, since we're trying to get you on a good schedule and you're not used to brushing all the time, just do it once. But remember, floss before you brush.
Okay.
So we can get into that gum area.
Okay.
Okay. Any questions like that?
No, I think I'm good.
All right, so now it's your time. I'm going to give you the model, and you're going to kind of show me how I showed you how to do it, and then I'll kind of give you some critiques on it, okay?
Okay.
And make it better. So there you go. There's a toothbrush.
Okay.
So I'm going to get you to show me how you brush.
So you said 45 degree and kind of motioning like this, and then when I'm done, I flick away from it.
Yep, but whenever you're brushing, you want to make sure your mouth is open so you're not damaging that bottom gum. Perfect.
That, and then...
Yep, perfect. I'm going to get you to try it on another section so we make sure we're doing it correctly. So you want to kind of come up at the tooth. There you go. Don't go so far to the gum.
Nice. And
Yep, perfect. And there you go. Now when you're doing that, I know it's really hard, so let's try to go like this. Does that make it a little bit easier for you?
Right.
Yep, so it doesn't feel like your mouth is so full.
okay. And then same thing, just flicking away from the gums.
Yeah, perfect. It looks good. You're doing really good. So let's try the flossing. Make it easier. Let me do that. And if I need to, I can hold the model for you.
You said,
So you saw it now.
and then 1, 2, 3, 1, 2, 3, and then change the floss.
Yep, perfect. You're doing really good. There you go. All right, now let's try it on the other side, and then we'll be good with that.
Okay.
And then we don't have to do the fluoride mouth rinse since you already did it. You already showed me how you do that. Sometimes your contacts are open, so it's very hard to keep that floss to stay in there. Just try your best. That's all you can do. All right. So I'll take that from you. Perfect. Perfect. You're doing really good. So the thing to remember today is that you want to remember to brush and floss. But what's the key important thing you got to remember? You got to floss before you brush.
And then brush.
Yeah, perfect. So that's the only thing you got to remember. Once you remember that, you do it. All right, I'm going to take this from you. And then like I said, I referred, and like this pamphlet is from the ADA, so you can use this. And also a good thing to get some information is dentalcare.com if you have any information you want to get. Okay? That's a really good one. And it also like has little tests and like documents and like real life like information that you really need is like very important. But that's what our job is, to kind of inform you on everything you need to know. So is there any questions you have?
No, I think I'm good.
Okay. All right, sir. Well, I think today went great. I'm going to give you the pamphlets and everything, and then I'm going to get everything off of you, and then we'll get you out here today.
Thank you.